Welcome to HIPAA Security Suite's Cybersecurity in Healthcare series. We're going to be discussing ransomware in healthcare, what you need to know. My name is Jeff Mongelli, and I'm the founder and CEO of Acentec Inc. Acentec is a nationwide provider of IT, security, and compliance services to the healthcare industry. We're going to be talking about what ransomware is, how it infects you, how to prevent it, and how to handle an attack. So what exactly is ransomware? Ransomware is a type of malware or malicious software that infects computers. In the case of ransomware, it locks you out of your data. Most commonly, ransomware will encrypt your information and require you to pay a miscreant a fee to retrieve that information. However, ransomware doesn't always have to encrypt your data. The main part of ransomware is in preventing you from getting to your information, essentially locking you out of your own data. What does ransomware look like? Well, chances are, if you've seen this screen, then you've learned the hard way what ransomware is. This is an example of the w.cry ransomware variant that attacked hundreds of thousands of machines in just a few days. Most ransomware variants will display a similar screen. Sometimes they actually appear and say they're from a federal agency. What's consistent on all ransomware screens is a countdown timer indicating when your data will be destroyed if payment isn't received, and how to make payment. Most commonly, that's with a cryptocurrency like Bitcoins. Now, it may seem like ransomware is a new phenomenon, but in reality, it was first developed in 1989. However, newer encryption technologies and the growth of what's known as the dark web have caused the concept to take root. Small attacks were first reported in Russia in 2005, but it was CryptoLocker in 2013 that put ransomware on the cyber radar. CryptoLocker infected over 500,000 systems in the first 6 months. w.cry infected far more in much less time. In fact, it's now estimated there are over 4,000 daily ransomware attacks, and that's up over 300% since last year. As I mentioned, one of the main reasons for the growth of ransomware is because it is readily available on the dark web. In fact, you can create your own copy of ransomware by going to the dark web through the free Tor browser, where for less than $100 and the ability to fill out a web form, you can target a specific industry or a specific range of internet addresses and launch your very own personalized ransomware attack. Now that we know a little bit about what ransomware is, let's take a look at why the w.cry variant was so effective in such a short period of time, and why it raised so much concern. For starters, w.cry was the first ransomware variant to include a worm replicator, along with its Trojan of malicious code. The worm went into recipients' contact lists and forwarded itself onto other people in that list, enabling the virus to spread very rapidly. It also employed some very advanced code to avoid sandboxing detection. Finally, it was a zero-day attack. What this means is it was able to appear in several countries at once before any of the antivirus and anti-malware companies had identified its signature. A closer look reveals the anatomy of a typical Trojan virus, which is how most ransomware is designed. What was different about w.cry was the worm portion that was embedded into the Trojan code. w.cry also employed some advanced sandboxing detection technology. Basically, sandboxing is a protected space. You can think of it like a padded room where incoming files go and are evaluated, but nothing gets out. An example would be an attachment like a PDF that has code hidden inside of it. Once clicked on, that code is initiated. Well, in a sandbox, this activity is detected, blocked, and thwarted. With w.cry, it actually detected that it was in a sandbox environment and terminated its activity. The result was it would appear innocent and be passed through. However, This proved to be w.cry's Achilles heel. The server that they were reaching out to was hard-coded to an unregistered domain name, and a malware tech in England identified that in the code. He simply purchased the domain name for that server and shut down all of its responses. Now, this didn't stop w.cry. However, it's still propagating across the world, but has been dramatically decreased in its effectiveness, and the viral component has been greatly diminished. The bad news is this is the beginning of more advanced threats. We're already seeing w.cry variants without the critical design flaw. We're also seeing more device-specific attacks, particularly in healthcare, where more and more devices are network and internet enabled. In fact, if you're running a PAX or RIS system that's still on XP, you've got to replace it. That liability is on you, not just on your vendor. Data centers are also becoming focal points for attacks. With hundreds of thousands of servers lying behind fewer firewalls, they're becoming a target-rich opportunity. And with advancements in the ability to jump out of a virtual server, a hacker can now get into one virtual machine and gain access to all of the VMs on that hosting server. You can also expect to see more two-faced malware. You may download an innocent screensaver that plays nice and friendly until a specific point in time when it releases an attack. Finally, attacks known as blastware and ghostware are being identified. These are attacks that leave no traces, making both detection and prevention more difficult. In the case of blastware, this variant typically destroys the devices it penetrated by wiping the drive or worse. With the threat of a cyber attack hitting your practice on the rise, let's look at how attacks get into your network. There are numerous threat vectors that get exploited, but the majority of attacks come through emails or phishing schemes. We're going to focus on that next, but right now I want to briefly touch on some of the other methods. Some commonly used software, like Adobe Flash and Microsoft Silverlight, just to name two, have known vulnerabilities. We highly recommend removing those from your workstations. Recently, we became aware of an attack launched by a popular game hosted on a major gaming site. One of their servers had been compromised, and the estimate is millions of machines were exposed. If you're playing internet games at the office, you could be employee zero in a catastrophic attack. Since emails are the most common attack vector, I'm going to show some examples of what to look for. In this example, you've received a money transfer. Hooray, right? Well, let's open the attachment and see how much money we got. Believe it or not, plenty of people fall for it. Look, no one you don't know is going to send you money. And there's no Nigerian prince who has to use you to transfer millions of US dollars out of his country. Don't take the bait. The truth is, however, that some of the deceptions are quite good, and you do have to look closely to avoid a problem. In this case, for example, we can see that this email appears to have been sent from a Barbara Feldman. But upon closer inspection, we can see that it was sent from a more general email address. Another popular scam approach is with a phony invoice. These spoofs can be good. They can look like they've actually come from AT&T or, in this case, SAP, for example. But upon closer inspection, we can see that this email comes from a different address than it appears. Be sure to look closely at the sender's email address. That's frequently a giveaway. For me, if you're not in my contact list, your email automatically goes to spam. That simplifies my email management quite a bit on a daily basis. This next example is a common scenario in our healthcare setting. Here is an email with a spoofed UCLA Medical Center address that looks like it's regarding patient information. Not only is the actual email not a UCLA email, but when I hover over the link, I can see in the pop-up and down below, the link is not what it says it is. It's not going to Dropbox, and it's not a PDF. This is the most common phishing scheme you will see. Hover over the links, inspect the sender's email address closely. After seeing this, you'd have to be crazy to click the link, right? So that's what I did. And I was treated to this screen. Fortunately, because this wasn't a zero-day attack, Microsoft had already been made aware of the site and blocked access to it from its browser. If this had been a zero-day attack, I could have been infected with ransomware, a virus, or any other type of malicious attack. Don't worry, I was in a protected environment when I did this. Well, it probably isn't a surprise to any of you that healthcare is one of the most targeted industries by hackers. The data is valuable. It frequently includes identity and insurance information along with its most personal healthcare information. There's also generally less security compared to, say, the financial sector, which has had to comply with numerous security regulations for years. And as I mentioned previously, there are too many instances of systems running outdated software that's no longer being patched. Adding to the challenge is the requirement to share data across institutions and with patients. All of this creates a perfect storm for hackers that we don't see changing anytime soon. So what can you do about it? How do you reduce your risk? To use a dated expression, it's never been more true that an ounce of prevention is worth a pound of cure. The best way to prevent an attack is to be prepared ahead of time. Consistent workforce training, phishing scam tests, and a real firewall is a start. If you're using the firewall provided by your internet service provider, chances are it's not providing the type of protection you think you're getting. Also, critically important is your backup policy. Having on-site, off-site, and offline current backups can save you from an otherwise catastrophic attack. And of course, how your network is configured makes a big difference. Finding the balance between being completely locked down but still productive can take the time and expertise, but most of all, it requires your attention. If you're still living in the days where your cousin handles your IT and you only call them when you need them, you're not being effectively managed. And that means increased risk and liability to you and your business. Along with the other areas we've touched on, even if you have rock-solid IT in place, we highly recommend having a third party conduct regular security risk assessments. Not only are regular risk assessments required by HIPAA, they're also the best way to identify weaknesses and address any vulnerabilities that you may have. For general guidance, we recommend your IT implement certain steps. Running antivirus and anti-malware is a must on all of your devices, including your mobile, and keep them up to date. Use a firewall that can do intrusion detection. Remove browser extensions like Yahoo and others. Use ad blocking software. Malicious code hiding in advertisements is an important threat vector. Remove network shares. Shared drives are an invitation for an infected machine to crawl across your network. Finally, and I can't stress this enough, the importance of investing in a serious backup solution. But more on that shortly. Another consideration should be your policies and procedures. The Omnibus Rule in 2013 changed many things, and your policies should be current and address those changes. Not only do you need to include specific policies you may not have previously considered, but your policies need to reflect your actual practice. We're seeing an increased number of fines citing a failure to adhere to stated policies. Don't let that happen to you. I mentioned earlier the importance of a comprehensive backup strategy. The truth is, if you're attacked, and some people think it's more like when, not if, you get attacked, your backup may be the only thing that saves your practice. What constitutes a sound backup strategy? Some viruses, including strains of ransomware, have been known to corrupt backups. So having a local backup on your network isn't going to get it done. Having an offsite backup isn't good enough either. Any attached backup file can potentially get corrupted or re-encrypted in the event of an attack. We highly recommend looking into a business disaster recovery solution. A good BDR will maintain local and remote backups along with online copies. In the event of an attack or server failure, a good BDR can take over as your main server and keep you up and running with only seconds to minutes of downtime and lost data. One question we frequently get is if a ransomware attack is a HIPAA breach. While it's certainly a security incident under the HIPAA security rule, the determination of whether PHI was breached would be established by your required security incident response procedures. The Office for Civil Rights has stated that if your data was in fact encrypted by an unauthorized individual, then it was a breach under the HIPAA privacy rule. The only way to know for certain if it was a reportable event is by conducting what we call an incident risk analysis. If you have any doubts, we suggest you report the attack as a breach. You can also contact us to do a forensics analysis. So what happens if you do get attacked? What do you do? Well, in the case of Hollywood Presbyterian Medical Center and many others, the decision was made to simply pay the ransom. After being down for a week, they concluded the reported $17,000 fee was less costly than the time it would take to fully restore all of their systems. However, paying the ransom isn't a guarantee you'll get your data back. These are not the most upstanding people we're talking about. With w.cry, numerous reports circulated from people who paid but got nothing. If you're a user and you get attacked, freeze. Don't touch anything. Don't shut off your machine or reboot. Tools exist that may be able to recover your system as long as it hasn't been shut down or rebooted. Then contact your information security officer or your competent IT person. In the event of an attack and your management, you should engage your security incident response policy, which of course you have. I know our clients have them. That should include performing an incident risk assessment to determine the extent of the attack and if PHI was in fact breached. Sooner rather than later, you should contact your cyber insurance policy carrier and get them involved. OCR also recommends you contact your local FBI office and your local U.S. Secret Service office. Or if you're one of our clients, you can contact Acentec and we'll navigate the process, conduct the forensics analysis, and work with your cyber insurance company and your attorneys to address their requirements. Speaking of your cyber insurance policyholder, after this presentation would be a good time to contact them about increasing your coverage. Frankly, if you have less than $50,000 per provider, in our opinion, you're underinsured. We recommend at least $100,000 of coverage per provider for your cyber insurance. What can we do for you? We have over 12 years of IT expertise exclusively serving the healthcare industry nationwide. Our comprehensive HIPAA compliance process includes everything you need: a NIST-based risk assessment, including a deep technical systems analysis, customized policies and procedures, and unlimited staff training, all through our exclusive web-based application. It's more than a simplified compliance process. It's a risk management solution that's easy and affordable. We also encourage you to sign up for our free weekly HIPAA security reminders. These short, sometimes funny emails are a great way to meet a HIPAA best practice recommendation and to keep your staff thinking about security. You can sign up for them on our HIPAASecuritySuite.com website or at our parent site, Acentec.com. Thank you for attending today's presentation. We hope you found it beneficial and informative. If you have any questions, please feel free to call our offices at 800-970-0402 or send me an email at jeffm@acentec.com. Have a safe and productive afternoon.